welcome.
Thank you. Great to be
Canada.
here.
So I want you to meet a brand new friend of the Bespoke Wellness Group. Your company is called Longevity AI. Tell us a little about why now. You were doing data science. You've always been a data scientist and Olympic level skier. So why now in healthcare?
Well, I think each of us has our own reasons, but I think it's a combination of my private situation and the industry. Specifically, I was in this really nice, cushy job doing some great AI. And my father was diagnosed with a late-stage lung cancer. And it was monitored by the best doctors, best executive health care, but it was still missed. And I think that what bothered me the most is that classic medical standards and just using available data to try to understand what are the upcoming health challenges could have prevented that.
So I can fully relate to that because I decided I want to be a doctor because my uncle was a global executive that got cancer really young. And inside my mother's side of the family, the people, in retrospect, I realized was exposed to carcinogens.
I see.
Ended up with cancer. And I'm here like, not me, thank you very much. So my world now is focused on teaching people how to live a healthier, longer life. So where we're at, due to a mutual friend, is that I've been waiting for you my entire life.
I've been waiting for you. We've been waiting for years to take all this big data that we're working with, hundreds of thousands of patients and lines of data, and really see forward-thinking clinicians, entrepreneurs that can really understand the value of predictive and preventative medicine. Because today's world, unfortunately, is more about, oh, something's broken, let's try and fix it. But when we're talking about 80% of our unhealthy years, they are predictable and preventable.
Yes, starting with your blueprint, your genetics, right?
Yeah.
Nobody uses it.
Absolutely. That's so unfortunate. It predicts so much, and you can help it to really fine-tune your lifestyle. Things that you love, just maybe slightly more, slightly less, and you can live many more healthy years and start feeling better tomorrow.
I really like a graph that you showed, which was there is lifespan, which is the day you born and the day you die. And then there is health span, which is your healthy years.
Exactly.
And then the gap is what you call longevity years.
Exactly.
All right. So that's why you're called Longevity AI, and I'm a longevity clinic.
Yeah.
So your company is called Longevity AI. Now, I want you to explain to people out there, because AI is like the buzzword. It's like when I was growing up, it's like internet. What the heck is that? World Wide Web. So do us the version that you explained to your 5-year-old brother.
Okay. We have a lot of information, a lot of data for a lot of people. And we're just looking for patterns. We're looking for what does it look like when somebody's aging, an aging heart, an aging brain, an aging metabolic system. And eventually, because we're using specific algorithms and we're having a lot of data, we can see the commonalities. What does it look like when the heart system is aging, and what people are usually doing to prevent that? What we do, we feed the machine only things that are evidence-based medicine. So all physicians would agree on the reasoning behind it. And then we look for the patterns.
Right. So if I was 5 years old and I go, Uncle Guy, tell me in one sentence, what do you do? What is AI, Uncle Guy? What is AI? One sentence.
AI is your companion to find patterns within you and how to optimize it.
And how is it done? And you mentioned something like machine learning?
Yeah, absolutely.
So why do we call it AI and not machine learning?
That's a good question. Behind every AI is basically machine learning, which
and
is...
what is machine learning? Do I go take out the snowplow and get it to learn? No.
Yeah, you could.
Okay.
If it had a CPU, if it had a chip behind it, you could.
Okay, all right.
But then you had to insert some information. So you can get a snowplow and do like that, or you can do it the other side, and you'll see that you're doing better on that side. And then the machine will learn according to the result. So if you're giving examples of data, and you're giving result of yay or nay, eventually the snowplow, with a bit of eyes to see what you're doing and the chip.
So ChatGPT, now I use it. Is that machine learning? What is machine learning? Is it
ChatGPT,
so AI is just a sexy way of calling it?
In some ways, yes. It's a big debate in the industry. What is exactly defined as AI?
Oh, okay.
I think
what is it? So what's your debate? Where do you lie?
I think that it's for sure, in most cases, machine learning, which is a set of algorithms that are
What's algorithms?
Recipes. Algorithms are recipes. You do A, then you do B, and then you do C.
Okay.
And if you're using big data and statistical nature of recipes, then you're having machine learning. Question is, what is intelligence? Artificial for sure, right? We're not dealing with biology here. We're dealing with chips.
Yeah.
And they want to try and understand what are the patterns. But when does it become intelligence is a really good question. And I think that...
What does intelligence mean?
I think that intelligence is like a not really well-defined thing that happens between data and knowledge.
What is longevity AI?
It's the culmination of how we humans can fine-tune our lives to get more healthy years and feel better. And we're taking AI to look at the patterns of big data so it can really help inform me, you, and everybody what can small changes do for our well-being and health span.
Thank you. So what I love about your company, which is also called Longevity AI, leverages the science and I would call the research. So pure research articles on biomarkers and what that means in terms of once you do a test, if you do this test, it's yay or nay, then you have this problem, yay or nay, right? And that's important because the root of all the inputs is data-driven in terms of experience-driven from health professionals, medical professionals. So what does that mean for doctors now to have a piece of software that we can license from you? So what is it in it for my patients that I'm not giving to them today that adding your brains to my brains in an artificial way, what does my patient get? What do you get?
So we are merely your humble copilot, the copilot of the physician. So the physician has the expertise to understand the patient in front and to deliver great prescription of further tests, interventions, and even lifestyle that can help. What our AI, Longevity AI, knows how to do is to take huge chunks of data, hundreds of thousands of people, and look for patterns that are similar to the person in front of you. So you can say the classic standard from this and this and this paper shows that there is an increased risk for the heart, but the cognition, the metabolic system, the immune system, you know what, they're relatively okay, especially for your age. But the heart is just aging the fastest.
Okay.
So here are the biomarkers, here are the metrics that you should look at. And if you can actually improve those, like more steps, reduce your glucose, this is the turnkey moment that can really make the change.
So if your risk is going up higher and higher, then you can show me right away how I can bend the curve.
Exactly. Add 2,000 steps, bend the curve, gain more healthy years.
When I was at TELUS Health as Chief Wellness Officer, by and large, most of the apps were driven for consumers. Like the app was developed so the consumer can learn why steps were important to them, and hypothetically, this would improve their medical prospects and their health. So why is Longevity AI much more of a medical-driven app, and how is that better for me as a doctor and for my patient?
First of all, I think we can acknowledge steps are important, but there's other 99 things that I can do for my health today that are really beneficial for my health. Which one is it? Usually, if you go for a list of 100, it's none. You don't gain 100 new habits today. So I think the challenge of human beings is to understand the why and how can I really get a good impact with something I already love doing. So that's the best match that we do. It's like a matching algorithm, like when you go to your favorite YouTube, Netflix, and you find that sometimes you have a good match. So it's basically taking your medical condition, seeing what's aging the fastest, what do we want to slow down, looking at the metrics that are most influential, and we can really help reduce that pace of aging. Take the thing that you love to do, like from your phone, from your watch, lifestyle. Like how do you do your sports? At what time do you prefer it? When are you most efficient? What does it mean when you're having a good sleep? Did you walk that day? Did you have caffeine in the evening? All these elements of lifestyle are correlated to your statistics. And we can do a best match of how the physician would like to help you, but in ways that you love doing.
Yeah, so it's medical knowledge combined with lifestyle knowledge and putting it all into one. So it's much more of a medical-driven app than it is a consumer-driven app with lifestyle as the priority.
Correct.
So who gets access to this app? Can a patient get access to your app, download it, and put some of their blood and biomarkers in there? Can they use it on their own, or is this a medically supervised app?
This is a medical supervised app. We want to make sure that the medical information is done properly, and we are a copilot of the physician. So the physician can communicate medically driven lifestyle to the patient. So patients can download it, but then what they want to do, they want to meet you to get your guidance, and then they can come home with all your advice in the palm of their hand.
Okay. If you had a crystal ball, and I get to peer in it, where is medical AI going?
What we believe when looking at this ball is that anybody, anywhere, can just understand what is the next best thing for their health that they love to do, and their doctor just prescribes.
So Guy, this is what I've learned in the last 2 days hanging out with you, is that all the years of me making sure that we collected genetics, biochemistry, gut biomarkers, looking at hormones, looking at nutrient profiles, food sensitivity, which is really antibodies, immunity issues, and looking at lifestyle, sleeping, exercise, diet, that you can come and do what I cannot do, which is to say, dear John Smith, because of all these variables that I've collected, I can tell you where your health risk factors lie and tell you what of the things that you normally do right now can bend the curve to reduce your risk.
Absolutely.
Whether it's be heart disease, stroke, diabetes, cancer, and dementia.
Your patients are very lucky that you've collected all this data so they can get the advice from you.
Okay, so the question is,
yes,
now that I tell them the risk, I can prove with your data analytics and your machine learning that if you do this, your risk will come down. The question is, will they do it? Do you have a machine that makes them do it?
I think most likely
the AI.
yes.
Really?
Most
so
likely,
stay tuned. Beyond telling you what to do and how to do it, he's going to make you do it. We'll have to figure out how.
Only things
Stay
that you
tuned.
love. Yes.